Hello, welcome. We are really delighted today to have a special guest with us, and we were able to steal a little bit of our time to have a conversation together. Someone who's probably known to a lot of you at Providence St. Joseph Health, Maureen Bisognano, who has distinguished herself in several capacities. As a lot of you know, she was first the COO at the Institute for Healthcare Improvement, then the CEO, and I always kid Don Berwick that you made Don look really good and did a lot of the work behind it. But you've been doing a lot of exciting things since then, and we're so pleased that you're the chair of our advisory board for the Mental Health Initiative. So thank you for being here.
It's my great pleasure.
Great. And first of all, I think what a lot of people want to know is why mental health? What's important about mental health, and why would someone who could do so many different things in healthcare, why is this one of your areas of interest?
Well, there are a number of reasons, some of them professional and one of them very personal. A few years ago, my nephew, who had suffered quite a lot with drug addiction, died of an overdose. And I began to think deeply about how the healthcare system could have helped Mike, how we could have worked with him in a different way. And as I thought about it and began to do some more research into it, I began to explore the deep and troubling system that we've got right now related to drugs across the United States. And the more I looked into it and the more I felt the pain of losing Mike, the more I became really impassioned about doing some work in this area.
Well, you know, I just, you know, they had a wonderful piece on NPR this morning, and they highlighted some of the folks that this crisis is part of. And I think the number that people said there's going to be 65,000 deaths, give or take, this year in opioid overdose and related illnesses. But that's only just part of the whole mental health kind of spectrum that's out there.
That's what personally brought me into this area. And as I started to explore, I looked back as an example because Mike grew up in the same city in Massachusetts that I grew up in. And it's such a different place today. Mike isn't the only one. Right. Almost every day someone dies in that city from a drug overdose. So then I began to look upstream and start to think, could the healthcare system expand our view to working with children, as an example, and building resilience in children so that we could prevent addiction or prevent mental illness in some way? Could we work with teenagers to help them through the very difficult transition times that they have? And even I've started to work with AARP and look at the elderly and the impact of social isolation on the elderly. It's worse than smoking 15 cigarettes a day.
Wow. So
we've got it from kids to the elderly, and I think the healthcare system has divided the head from the rest of the body, and we really need to come back together.
Absolutely. So there too. And then I think the other group, when we kind of look at our own employees, our own people, and I've kind of looked at the health data on different companies. The number 1, 2, and 3 medications are either anti-anxiety medications or antidepressants. So we have it at the beginning, we have it towards the latter end of life, but also there's this big group of them in the middle that are also struggling with mental illness and the whole issue of resiliency there too. So it really crosses the spectrum.
Oh, especially in the healthcare workforce. I always say you can't give what you don't have. And if we don't work to create resilience and joy in the healthcare workforce, we can't give up the kind of challenges that we're asking for our staff to do. I've been looking into healthcare and found that it's the only profession I can find that is physically demanding and emotionally draining and intellectually challenging. And so the idea that we don't put them high on our radar for mental health and resilience means that we're going to pay that price downstream.
Oh, absolutely. And when we look at, both of us have been in healthcare a long time. We won't admit to how long that is. But if you go back as nurses, doctors, social workers, physical therapists, it was almost a thing where you couldn't show any emotion in terms of losing a patient or dealing with a family. And I think we're seeing the kind of cumulative effect of a lot of that over time, that we're seeing, it's manifested by burnout. If we look at the suicide rate amongst doctors and nurses, it's something we don't talk a lot about, but it's there. I had a professor of mine when I was a resident in Boston who was an ICU physician with 4 children who committed suicide in the hospital. So it's really around us, and I think particularly for the health professionals, it feels that way.
So I'm thinking we need to go upstream and understand what are the root causes of this problem and really begin to lead in a different way.
Right.
I certainly agree with what you're saying about the healthcare workforce and the challenges. I've worked with a lot of physicians and nurses, as an example, who've been involved with a medical error, and they take the pain so personally. And when I ask them how did they confront this at work, so many of them tell me that their boss, the chief or the head of the department, says it happens to everybody, go back to work, but it doesn't help them
Right.
to really live through that and understand how to prevent that from happening again and how not to take it out on themselves personally. In most cases, these are broken systems.
Right, right. And it's all you're living in. And then, I just want to go back to what you said, that we separated the head from everything else. And maybe just, for the group, kind of, I think I know what that means, but maybe for the group you could kind of explain what we did and how that happened.
I think the idea of treating psychiatric problems so differently and so separately, separate profession, separate buildings, even in working with the new Wellbeing Trust, I was talking with a psychiatrist who said, in a way, I've created the stigma. She said to me, I would tell patients, don't worry, you'll never see anybody else in the waiting room, and there's a back door you can go out. So we've said, if you have a mental illness, there's something really wrong with you, we're going to, in the way we've treated it, we've added to the stigma that makes it really difficult for someone to look at holistic health,
Right.
really whole health.
And I think, the whole so-called managed care revolution of the 90s kind of separated out even the way we pay for mental and behavioral services differently than medical, and we kind of know that those two fit together. And then this whole stigmatization, it kind of reminds me, there was a time when if we had got cancer, and particularly for women that got breast cancer, they never talked about it. And then we got through that, and then we got to HIV, and then you never revealed if you had HIV, and then we kind of pulled that out. And I get the same sense that we're in that same position with mental health, that we got to kind of put it out in the open and make that happen. Is that something you see us being able to do?
Oh, absolutely. It's going to take a social transformation. But I remember when my nephew Mike died, calling my sister-in-law, and I told her how grateful I was that in his obituary in the paper, she wrote that he died after suffering from drug addiction, because I said saying that really allows other people to talk about it. It allows people to really think this is a bigger problem than something that happens in that part of the city.
Right.
And I think we really do need, as healthcare leaders, to push through this transformation and putting us all together as whole people again.
And kind of doing, and then there's also this balance between almost everyone that has an illness, whether it's cardiac or cancer, there's almost, about almost 30 to 40% of the time, a concomitant mental health or behavioral issue that goes with that.
Oh, the stress of finding out that you've got a chronic disease or a terminal illness, or the stress in caring for someone who has that. We've just said, basically, suck it up, you can do it, and
Right.
It's not right. The physical burden that these people are bearing because of the psychological problems is something that we really need to step in and address.
Make a change. I think a big one too is postpartum depression.
Oh, sure.
Right? So how do we get in front of some of those issues? Because there are certain things that are predictable about that as an event, but it's incredibly profound, and we have these women that are isolated. They've got this problem. It's very, very real, yet everyone tells you, well, just push through that, and it's this sense of not being aware of it and not predicting that it can happen.
I think the idea here is for postpartum depression and for everything, if we can integrate a really simple assessment into every part. I mean, I like to see dentists asking, how are you doing?
Right.
And I think if we can begin to integrate that, quick assessment, 2-3 questions, and then link them into a system, we're taking the stigma away.
Right.
In Texas, there's a wonderful example where a lot of the African American population, the men are telling us that they're not really comfortable going to their primary care doctor for a lot of reasons. So there's a wonderful experiment down there now where barbers are, while they're cutting their hair, asking questions like, how are things going? Do you have the resources that you need? And at the end of the haircut, they're saying, do you mind if I take your blood pressure?
Wow.
And they'll take the blood pressure, and then they give the person a card that says, this is your blood pressure, and if you go and bring it to your doctor's office and get it signed, when you come back, I'll cut your hair for free.
Wow.
And so it's saying all of the assets of our communities can come together to try and help someone to say, I'm having a problem, physical or emotional or mental, and we've got the resources now that can help you.
Because it's always every event, then we start to get reality. And regardless how all of this in Las Vegas unfolds, and you see these kind of outbursts of things that happen, and then there's a collective, oh, we've got to do something about it, but we got to go beyond that. Because with so many of those situations, and again, not necessarily that one specifically, there's a lot that has happened way before that. And that when we go back and look at warning signs and what else is there and where else can we pick it up, we need to have more receptors that are telling us there's something there and that there's also somewhere to go.
You know, one of my favorite examples recently was I was in Scotland at a school. And what was so exciting for me, there were 2 things that happened. One was I met with a small group of kids. They were in the 10 to 12 age bracket. And I said to them, tell me about what you're learning. And they said, well, each one of us has 3 goals in life.
Wow.
The first one's academic. And so the kids were telling me, my weakness is math, or I'm working on writing. And they had a plan, and they had improvement skills, PDSA skills, to work on their academic achievements. But the second one is they said, we've got to be physically well.
Right.
So each one of them had a sport. And some were playing golf, and some were playing basketball. But each one of them was creating physical health by PDSA cycles. And the third is they said, we have to build our intellectual curiosity. So each one of them had some kind of a hobby, like I'm acting in a play, or I'm learning to take photographs, and I thought how beautiful it is that we've put all of these things together to say a successful adult needs to be academically brilliant and
Right.
physically fit and have assets that they can bring to the community. And looking at that whole person was just a brilliant example.
And you know, we've, you know, at Providence St. Joseph Health, we've spent a lot of time thinking about whole person care. You know, and for us, particularly as a faith-based organization, we think about mind, body, and spirit a lot. And it's funny how those things are now in vogue. And then the third area we think a lot about is community.
Yeah.
So the word community has a real strong understanding, and we think the way you move health is you move it through the community. And I think a lot of the issues around mental resilience are based on what does your community look like? And you know, that sense of isolation. But you've been traveling a lot around the world and kind of picking up pearls, both in healthcare, mental health, but all over. And you know, we always say is that a lot of the answers to what we want to think about in healthcare in general in the United States. Well, any pearls that you have from us about your journeys around the world?
Oh, I could give you a lot.
Yeah.
2 quick stories. One is I, again, was in Scotland working with a group of parents who had children, and the parents had addictions. They were either alcoholic or had drug addiction problems. And I met with a little boy, and he was 5 years old, and for the first 4 years of his life, he never spoke a word, and the only way he communicated was he would bite you. His parents had terrible behavioral problems themselves, and what I saw was a community come together. The little boy was in a residential program for the last year, And so all day long, he was learning from people who had adjusted how to acclimate to a life. And his parents were in treatment programs. And I remember when I first met him, he was walking down a hallway with a tray. And I said to him, I like your tie. He had on a little white shirt and a tie. And he said, this is a boy who had not spoken until 1 year before. He said, I take so much pride every morning in picking out which tie I want to wear.
Wow.
And he said, I every day get up thinking, how do I feel and which tie would express that? And I said to him, what's on your plate? And he said, oh, this is garlic bread. And I said, oh. And he said, would you like some? I made this. And I said, how did you make it? And he said, well, I put the yeast in warm water. I mean, he made the bread and then made the garlic bread. In 1 year, looking at a community of what do his parents need, what do his grandparents need, and what does this boy need, created health, and this kid's got such a future.
Wow.
Another story was I was in Africa in a clinic, and I met, I have this beautiful picture of a woman sitting with all her kids around her, and I was asking her about her health care and her visits to the clinic as she was waiting in the waiting room, and she had a little blue, like a notebook in her hand. And I said to her, what's the notebook? And she said, oh, that's my family's medical record. And so I said, oh, the record doesn't stay in the clinic. And she said, no, it's my family's medical record. And I said, what's in it? And she was showing me. And I said, does each member of your family have a different book? And she said, with a little exasperation in her voice, no, this is my family's medical record. And it opened my eyes to say, what have we done in taking a record and putting the GI radiology report over there and the mental health record over here and having everybody broken up? And she taught me something beautiful and wonderful about the way we need to move healthcare forward.
And it's just this sense of, you know, those examples and, you know, at relatively low cost that are profound in terms of what people are able to do. You know, we spend, a lot of our groups spend a lot of time in Guatemala. And when you spend time in the villages, these are really desperately poor villages. But what people come away with is that they don't feel the people are poor, though, right? If you look at their spirit and what they're comfortable with, they're not unhappy.
Yeah.
And so it's interesting to see that, and then it's interesting to see how much you can do with very, very little as you go forward. And I think we've kind of lost that sense of connection with the family and the community, and that's the first building block to really fixing our health system. And kind of we've done it kind of backwards a little bit, right?
You know, another story, I was looking at this wonderful example from Jersey in England, a small community where many of the residents are elderly and live alone. And the impact of social isolation on them meant that they were constantly seeking health care, calling their doctor, showing up in the emergency room. So a group got together and they said, what are the assets that we've got in this community? And they looked at everything. And the one that turns out to be the most impactful on physical health and mental health is the mailmen. The mailmen go every day to people's homes, drop the mail in, and then leave. So they asked a group of mailmen, do you want to be trained on how to assess risk? 3 times a week, they knock on the door, and the elderly people love it. They get all dressed up because the mailman's coming. And they don't go in, but they spend 10 to 15 minutes assessing their gait and looking at risk of falls. They ask, do you have enough medication or enough food? And there's a place for them to call back if they find risk. But it's not only providing a great reduction in the use of traditional health resources like showing up in the emergency room, it's adding meaning to the lives of the elderly and joy in work for the mailmen.
You know, that's just beautiful, beautiful story. How's the Institute doing? How's the Institute for Healthcare Improvement doing? And then the question a lot of people ask me, are there things that we've learned there that can be helpful in terms of our methodology for mental health?
Oh, I think there's so much to learn. The Institute has gone from when Dawn and I were back in the early days, the mission was to improve healthcare in North America. The mission today is to improve health and healthcare worldwide. And as you say, the examples that we're building in running improvement collaboratives and breakthrough series collaboratives around the world are really helping us to see upstream how can we prevent both physical and mental illness, and then taking a look at all of the assets. So it's a wonderful experience to be able to build improvement and innovation capabilities around the world.
That's, to me, it's so exciting, and I think what I think what I always talk about when I talk about the Institute, we had Crossing the Quality Chasm on the shelf for years, and we kind of admired the problem. And then I always say that you and Don kind of said, okay, we're going to do something about this and put it in real terms for people, lives and whatnot. And I have this hope that in mental health that we can do the same thing. We've observed the problem for a long time, and we've kind of looked at your nephew and all of this, and we kind of look at it. And now hopefully we're into like the action phase where we're going to do some things, and I think with the well-being trust and everything else, and kind of and I think one of the things that the Institute really well is embarrass people into action in a good way, right? But we kind of all know it's time to get engaged. And I think you and I, when we talk to our colleagues around the country, they're ready to get activated on this. I think they need a pathway, they need a bundle, they need a direction, but I think they're ready to go.
Well, I think Dawn and I, when we were launching the 100,000 Lives campaign, we did something pretty innovative, and that is we called our kids, who were working on political campaigns, and they said, well, how many lives do you want to save, and by when? And we said, oh, a lot, and soon. And they said, no, some is not a number, and soon is not a time. So we came up with 100,000 lives in 18 months, and now working with Derek Feely, as Derek brings his examples from Scotland, we're finding that we do need to be provocative and push people out of the comfort zone.
Kudos to your kids.
I know.
Right? Because that really helped people to think about it. And, board members and community members, when you put it, I think the bane of all of our existence are percentages or, this data that we use. But when we put it in real lives, and the impact that you and Don have had on so many board meetings where we actually put the names of the people and their lives affected and who they are has really kind of changed the discussion. And having those goals where it's lives over a certain amount of time really does that. And I think there's probably some analogies in mental health. We have things like suicide rates.
Yeah.
We have things like the number of folks that are addicted. We have a number of markers, and we need to kind of put some stakes in the ground around those.
I'm with you.
Make that happen. So thank you so much for being here.
Thank you for all you're doing.
We just love that you're part of us, and we were able to have you as part of our family. And I think everyone around, I know our organization is really excited about your leadership and what you can do. So thank you so much.
Together we'll save a lot of people's lives
great.
very soon.
Good. Thank you.